myself Dr. Subin. Welcome back to our YouTube channel. So today our subject is the signals, early signals or early symptoms of cancer which the body shows. That is our subject today. As you all know, the most common cause of overall population death is cardiovascular accident, that is CVA, heart attack. The second most common cause is, of course, it is the deadly cancer. So the main problem with the cancer is, as we are treating a lot of cancer patients in our clinic, daily cancer patients are coming here. So the most common problem with the cancer is the symptoms are appearing in the later stages of cancer. Usually the symptoms will come in third or fourth stage of cancer. So the patient will not know, the patient won't know about he is suffering with cancer. That is the main problem of cancer. So for the diagnosis and for the treatment also, it is very difficult in the later stage of cancer. So we have to identify some of the body signals, some of the body symptoms of cancer. So the American Cancer Association has implemented a word caution, CAUTION, word caution, to simply identify the symptoms of cancer which the body shows. So today I am going to talk about these early symptoms of cancer in a very easy way. You can identify you are having cancer or not. So that is our topic of presentation. As I told, the word is caution, CAUTION. So the first letter is C. So C stands for change in bowel or bladder. Change in bowel or bladder. So if there is any problem in our bowel movement or our urination for long days, at least 2 weeks, if the problem exists, so you have to consult a doctor. For example, if severe constipation, or one week constipation if you are having, or if there is a bleeding from the anus without pain, if you are having a bleeding with pain also or without pain also, if the bleeding is there, or in the urine, any problem, the color of the urine is changing, or difficulties in passing the urine, or any kind of that change in bladder or bowel is a very important sign. So you have to consult a doctor immediately. So the second letter is A, CA. The second letter is A. A stands for a sore or an ulcer which is not healing within 2 or 3 weeks. A sore or an ulcer which is not healing within 2 or 3 weeks. That is also a very important sign or signal from the body. That also you have to be careful about that. If an ulcer or a sore is not healing within 2 to 3 weeks, you should be careful about that sore or ulcer. So the next letter is U. U stands for unusual discharge or bleeding from mouth, nose, anus or genital area. So this is also a very important signal from the body. So if there is any bleeding from the mouth or nose or genital areas or through urine or anus or any kind of discharge, also you should take care. That is another important signal for the early detection of cancer. So the next one is CAUT. T stands for thickening of a mass or a lump, thickened mass or a lump or a tumor in any part of the body, especially superficially any mass or any tumor kind of appearance you are observing in your body, in the mouth, in the skin or anywhere, that also a signal for the cancer diagnosis. So if it persisting for, as I told, 2 to 3 weeks continuously, it is not coming down, you should consult a doctor immediately. Next is CAUTI. I stands for ingestion or difficulty in anything. For example, whenever you are taking any food, you are having any swallowing problem, or you are having any pain in taking the food or water, or any burning pain you are having, any swallowing difficulty you are having, that is also a very important signal. So CAUTIO. O stands for, that is obvious change, that is a markably change in any mole or wart in our body. That is obvious change in any wart or mole of our body. So definitely all are having mole or wart in our body. So some days we are observing that the mole or our wart is changing in its color or texture or its size or anything, continuously it is changing. That is obvious change, a markable change. If you are noticing, that is also a very important. So the last letter is N. N stands for nagging cough or hoarseness of voice. So if you are having a cough, and if you are having a difficulty or in speaking, or your voice is changing, so you should be taken care and you should consult a doctor. So these 8 symptoms, as I mentioned by the word caution, you can easily remember this particular word caution, and you can identify the signal or symptom from the body. And it is not 100% sure that if you are having all these symptoms or 2 or 3 symptoms, you are suffering with cancer. It is not like that. Please understand like that. It is not like that. It may be a warning signal, or it may be a symptom of cancer. So if you are suffering with these symptoms at least 2 to 3 weeks, and it is not reducing by the normal medicine or by naturally, it is not reducing, you can consult a doctor. So this is the information today we are sharing. Thank you very much.